Right. Dr. Preece, there's this thing out there, sedation dentistry, where basically, painless dentistry, whatever it may be called, but many of us have a confusion. Are we like unconscious, like with a appendix operation, or are we, what's happening there, and are you doing it?
Yeah, sedation dentistry involves lots of different things and different levels, and it depends on the dentist's level of training and expertise as to what they can do. Most of the oral surgeons, for instance, have the capability of doing IV sedation and putting a person totally to sleep, like when you have an operation in the hospital. But I myself practice what we call oral conscious sedation, in which the patient comes in and receives a couple of pills. We use triazolam, which is a cousin to Valium. It takes about an hour, hour and a half for the pills to work, and it makes the patient very groggy and relaxed. Sometimes we use nitrous oxide gas along with that to help. But the nice part about it is the patient's calmer. It's easier to work on them. They're more relaxed. The appointment seems to go faster. We may be there for 2 or 3 hours, and it might seem like a half hour to the patient. And the real nice part is the next day they don't remember very much of what happened. There's an amnesia effect. So if something did bother them, then the next day they wouldn't remember it, so they wouldn't be scared and worried about their future dental appointments. So it's been a real boon to dentistry and to my practice to be able to offer that to patients. It's definitely a lot of patients who normally wouldn't receive dentistry has been able to come in and have things done with sedation.
Wow. So what you're saying is, but basically you can do a lot more dentistry, 3, 4, 5, 6, 7 teeth. You can do a bunch of implants, a bunch of crowns, or a couple, 2, 3, 4 root canals if needed. I mean, whatever it is, simply because you can work on the patient for 2, 3, and 4 hours, rather than the patient having to come back 4, 5, and 6 times to get the same amount of work done.
Exactly.
Wow. I mean, just in time alone, whatever sedation dentistry costs, that must be well worth it. Never mind, I mean, never mind if you have all the time in the world, financially independent, having a lots of time. Who wants to sit 6 times in a dental office if you can get it over with one shot? And, as you said, it doesn't feel like you were in there for 2, 3, or 4, or 5, 6 hours.
Right. Time goes lots faster that way.
Yeah, because, I mean, I guess even though, like dentistry really doesn't hurt anymore very much, you guys know how to give injections wonderful, and you even, pre-numb the gums before you put the injection. There's really no pain involved, but there still is that sitting there and having that mouth open for an hour or two, and, you look at the ceiling and you kind of start counting sheeps, And so you're saying that that sedation dentistry avoids that and time just flies.
Yes. And especially if they're listening to some relaxing music or something, it's not near as traumatic for them. So that works out well.
So are the patients during that time, if you ask them a question, could they respond to it? Are they awake?
Yes, and that's the important thing. They still have all their natural reflexes, their swallowing reflexes and things like that. So it's much safer than having a person put out completely, because they're still conscious. And you don't want to have them so sedated that they lose those reflexes. So they can still answer questions. They don't necessarily the next day remember talking to you, and you can't really give them any instructions because they won't remember it. But they at the moment can tell you if they're hurting, if they need more anesthetic, or if they need to get up and go to the restroom, or if they need to just close their mouth because it's tired. So they can communicate with you.
Wow. Well, that sounds like almost a wonderful thing, I guess.
It is.
Considering that you are in a dental office. It must be kind of like difficult sometimes for you dentists to kind of have patients sitting in a chair and saying, I hate coming to you. And yet, have no choice, and yet are very happy because I'm having a toothache and I got to come to you, and yet I hate to come to you, kind of a dichotomy. It's not like buying a new car. I love it. You know what I mean? It's like, oh my God, it's like, I need it.
Dentists have to have thick skins and good self-esteem to get through it.
Right. But so sedation dentistry seems to be something which is helping, and not every dentist is doing that, right?
That's correct. You have to have some extra training after dental school and extra courses to offer it safely, because that's the number one thing. You want to make sure the patient always is safe, and you don't want to do anything that will harm them. So, and so with that training, that helps to accomplish that.
Well, wonderful. All right. Thanks a lot, Dr. Preece. I'm sure this is good information for the people out there to know that. I personally would like the fact that, if you have a whole bunch of work to do and say, well, can we knock this out in an afternoon? I come at noon, I walk home at 4 o'clock, and, maybe I have a taxi waiting for me or whatever it may be, and let's go home, and that's it. That's the end of it. I'm done. Sounds like a great thing to me.
It is. It's a blessing.
Good. Bye-bye.